Having been in the field for almost 10 years, and 10 years including my practicum, I've had the privilege of working with a very diverse set of patients, and anger management actually becomes a very common conversation. And what's necessary in clinical work is having a meaningful and individualized working definition of what anger management actually is. And so, in coming back to that in a moment, the work that I do with my patients is helping them understand that anger is not an enemy. I really regret that anger gets such a bad reputation in society. And so, from an internal family systems perspective, if we see our anger as a part, then we understand that it's less about managing the anger and it's more about relating with the anger. And when we think about management, we think about dysregulation, and you've got to get curious about where is this dysregulation originating from. Internal family systems is such a non-pathological, inviting, accessible form of therapy. And when you can entertain the idea that an angry part or any of your parts, they're not doing what they're doing for shits and giggles. They're doing it because they are hurt. And so engaging with a patient who has a presenting concern around anger management, it's helping them understand the language that they're using, helping them understand that anger isn't bad or good. It's just a part. Getting curious about how they've grown up in a society that might actually have institutionally oppressed that anger, and creating an emotionally attuned and supportive space within the therapeutic environment that allows that anger to come out. And I have had the privilege of working with people whose anger parts come out, and by and large, they're always kids. And I have an angry part. He's my 8-year-old, and he needs a lot of support. Working with my patients who have so-called anger management, I want to change that language to, I've got an angry part who really needs to be understood. And it's my job as your therapist or as a therapist to help you understand ways and strategies to work with that part in a way that helps them open up. And you'll often find out what they're protecting you from is actually pain or fear.